Hello, and welcome to our webinar on understanding the opioids crisis and new requirements in Oregon. Please feel free to say hi in the chat and let us know what district or agency you're coming from. And we love to see that there are people from across the state joining today. My name is Yesenia Ayala, and I'm part of the WestEd team, and I will be providing some framing for today's session. And today's webinar is presented by the Oregon Department of Education and WestEd. A couple of housekeeping items. So during the sessions, participants will remain muted with their video off, but are invited to engage with us by sharing comments via the chat. Also, please feel free to submit questions for our presenters via the Q&A feature. And the session will be recorded and posted in ODE's K-12 Substance Use Prevention and Intervention webpage, as well as to ODE's YouTube page. We have 60 minutes together today, and our session objectives include to review the signs and symptoms of opioid misuse and overdoses among students, explore the scope and impact of the opioid epidemic on students' health, well-being, and academic success, and discuss current evidence-based strategies and programs to prevent opioid misuse, including promoting healthy coping mechanisms and fostering supportive environments. In terms of our agenda for today, we'll get started with some welcome and introductions. We'll also dive deeper in terms of the opioid crisis in the US and then look at it through the opioid crisis in Oregon. We'll also have a section on Oregon's response to the crisis, and then we'll end with a Q&A with Alana Russell from the Oregon Department of Education. So we do want to make sure that we share that this webinar will cover sensitive topics related to opioid misuse prevention, the trauma associated with the opioid epidemic and its impact on students in the state of Oregon. So we do want to emphasize that the discussion aims to equip educators with effective planning strategies while emphasizing the importance of inclusive and non-shaming language. And lastly, our goal is really to create a respectful, supportive environment for learning and collaboration. Some content may evoke strong emotions or discomfort, so participants should take care for their well-being. So if you have any concerns or need support, please let us know during and after our session. Now I will pass it over to Alana Russell from the Oregon Department of Education.
Hi, everyone. My name is Alana Russell. My pronouns are she, her, and I'm the Substance Use Prevention Education Coordinator with the Oregon Department of Education. Here at ODE, we serve over 560,000 students across 197 school districts. Our mission is to foster equity and excellence for every learner through collaboration with educators, partners, and communities. Specifically, my role here at the agency is to provide technical assistance and support for school districts related to substance use prevention and intervention in K-12 schools, as well as to serve as a state level point of contact and liaison for schools related to their substance use prevention work. As part of this work, I've been fortunate to collaborate with WestEd to develop this learning series, as well as a suite of other resources that are designed to support school districts across the state in substance use prevention efforts. I am very grateful to be joining you all today. And I invite you, if your learning today leads you to additional questions or ideas or ways that you think we can be supporting your school, please do reach out to me. You will be provided my contact information in a follow-up email after this webinar. And you are also encouraged to reach out to me if you would like any professional development units for this. But I'm always happy to collaborate and lend my support however I can. And with that, I will go ahead and pass it to one of my WestEd partners, Derek.
Thank you, Alana, and thank you, Yessie. So my name is Derek Lowry. I work with WestEd. I am a Senior Justice Technical Assistant Specialist, and I'm going to introduce Dr. Loeffler Cobia and Colleen Carter. Both of them will be speaking with me today on this webinar. And Dr. Loeffler Cobia is a Director of Justice and Public Health Policy and Practice, and Colleen Carter is a Research Associate with WestEd. So WestEd is a research development and service agency, and we are dedicated to improving education, health, and human development outcomes for children, youth, and adults. We focus on research and evaluation, professional development, and technical assistance across the U.S. We support schools, districts, states, local governing bodies, and local and national organizations in implementing effective strategies. Our key focus areas include education, health and well-being, and improved justice outcomes. So I'm also going to walk us through a quick icebreaker poll activity. So this is a fact or myth activity. I'm going to read a statement and then we're going to poll you, and you can tell us whether you think the statement is a fact or a myth, and then we're going to share the answer with you. So the first statement, opioid impacts across Oregon are generally restricted to large urban areas with dense populations. Is this fact or myth? Can you reflect the answer back out? So it looks like 100% say that this is a myth. This is a myth, so 100% are correct. Opioid impacts in Oregon are varied across counties and regions. They demonstrate impact in rural and urban areas. Even in counties with low population density, some experience high rates of impact versus high counts of impacts, and we'll get into that a bit later as well. So for the next statement, the rate of U.S. overdose fatalities, including opioid-related fatalities, were not impacted by the COVID-19 pandemic. So what do you all think? Let's go ahead and share the results, I think. So 97% think that this is a myth and 3% think that this is a fact. Let's see. This is a myth. Overdose fatalities actually spiked during the COVID-19 pandemic, and though they declined after the pandemic, the rates of overdose opioid fatalities are still higher than they were pre-pandemic. And I think that was pretty even across most of the U.S. So at this point, I'm going to hand it off to my colleague, Dr. Loeffler-Cobia, to talk about the opioid crisis in the U.S.
Thanks, Derek, and thanks for that great activity, Derek. It kind of gets our thinking going about this opioid epidemic. And like Derek said, I'm Dr. Jennifer Loeffler-Cobia, and I just want to go over just a few little bits of information about the opioid epidemic just across the nation and our current landscape of where we are right now. So if we think about opioids, we really think about kind of two categories of opioids. One is what we call more opiates, which are natural opioids in our environment. We've heard of heroin, we've heard of morphine. Those are natural opioids that are in our environment that we can, make certain drugs from. Then we have our more synthetic drugs, which I think probably some of us are even more familiar in today's terms, which we've probably heard of oxycodone, we've probably heard of methadone, and most importantly, or more that we've heard of more about lately, is fentanyl. Fentanyl is the one that we're really targeting right now because of, number one, its potency. It's 100 times more potent and lethal than morphine. And so we're really seeing that this opioid epidemic, overdose epidemic, exacerbated because of fentanyl. The other piece to it is we're also seeing fentanyl laced into other drugs. And so it's things like Adderall or benzodiazepines. They're being mixed with benzodiazepines. They're being mixed with tranquilizer drugs as well. So it's really making it a hard epidemic to really address because of this fentanyl and the ability to make it in a lab being synthetic. So if we can go to the next slide. So just to give you kind of an overview of, just in 2024, and this is great that we have 2024 data about the opioid overdose epidemic, we've nationally lost close to 60,000 people just in the last year in 2024 to an overdose death. That's a lot of our family, that's a lot of our dads, our moms, our siblings, our cousins. And unfortunately, probably most of us have a story that we can tell in terms of we have been either impacted individually, maybe with a substance use disorder ourselves, or we've impacted indirectly by, losing a loved one or a friend. So we really need to think about how are the ways, how did we get here, and what do we need to do to continue to combat this overdose epidemic? So I want to just quickly talk to you about how did we get here? And I'm not going to stem back clear to the Civil War, because literally this epidemic can stem back to the Civil War with the use of heroin and morphine. But where we are currently within the last couple of decades is we really look at this in three waves. And hopefully you can see this on your screen clearly. But in that wave one, because of the synthetic ability of being able to make opioids rather than those, natural drugs, heroin, morphine that I talked about, we started to see prescriptions and pharmaceutical companies make opioids for painkillers, right? We saw this marketed to our physicians. We saw things like OxyContin come out in the early 90s, early 2000s to say, hey, we can take this opioid, it's safe, it's not addictive, and we've made this new painkiller. And so we saw this first wave of the overdose epidemic because what we quickly learned is that this OxyContin, the synthetic opioid, was actually very addictive. But people were thinking, oh, it's legal because we're getting it through a prescription, therefore it's okay. What happened was then we went into the second wave where once we realized these prescriptions were causing deaths, we worked with prescribers, we worked with physicians, pharmaceutical companies to reduce those prescriptions. But what happened is then we have this population now with a substance use disorder or addiction to the opioids. And so those folks were then moving to the streets to then try to get heroin to get that same kind of high. And really can revert to that illegal use of opioids. And that was that wave two that you can kind of see with that blue line. And then all of a sudden, as you see with the spike, with the purple line here in this wave three, we have the introduction of fentanyl and some other drugs as well as tramadol and methadone. So when we see this spike with fentanyl, it's really caused this overdose epidemic and these deaths to spike. And that's the wave that we're in. I'm almost wanting to add a fourth wave in here, where we are starting to see, as I mentioned, that polysubstance use, where we're seeing fentanyl included with other drugs, like I mentioned before, benzodiazepines, tranquilizer drugs, Adderall, really being laced. And so it's just making this overdose epidemic even more complex. So I can go to the next slide, and this is just my last one. I want you to kind of keep in mind those waves that I just talked about. That first wave, we started seeing a slight increase, that second wave in deaths, and then this huge spike within the last 10 years or so with fentanyl. What you see on the right hand of your screen is a piece of research that I often refer to because it was a piece of research that researchers did back in 2019 that did a predictive study that said they looked at, hey, if we're on this trajectory right now at 2019, where are we going to be in 2025, right? So almost 6 or so years down the road. And what they predicted is that we would have, if we kept on the same trajectory of the services, the way we're addressing the epidemic, we would see a spike of tenfold of overdose deaths. And when I used to talk about this research, it was a couple of years ago, I said, okay, guys, we have 2-3 years to really think about this predictive study. But now we're here in 2025, and we are seeing this predictive study come to light. We're literally seeing these overdose deaths increase tenfold. So what do we do? And that's what we're going to talk about today. I'm going to turn it back over to Derek to talk about Oregon in terms of where is Oregon at in the overdose epidemic and some statistics and descriptives specifically to where you all are at. We're going to talk about legislation. Colleen's going to talk about some legislation to help combat the overdose epidemic. And then you're all going to hear back from Alana to really have some, Q&A to really talk about what are we doing? What can we do as educators to really play our part in fighting this epidemic? So you just really appreciate your time and just your commitment to really working with our kids, our youth, our families, and our communities, and really having that commitment to save lives. Derek, I'm going to turn it back over to you.
Yeah, thank you, Dr. Lafracobia. As you just noted, the opioid epidemic has been a pretty formidable challenge across the U.S., and it has affected countless lives and communities. So, for this section, we're going to focus on Oregon and highlight how the opioid crisis has impacted the state, how its impact is relative to other states across the U.S., what counties within Oregon have high impacts, and the impact of the opioid epidemic on youth, and some of the responses from Oregon's local leadership to the epidemic. So this is kind of the opioid overdose epidemic in Oregon slide. And, the COVID-19 pandemic unfortunately witnessed a sharp increase in opioid overdose deaths within Oregon. They increased sharply during that period, as they did in most other states. And 2023 also kind of saw a slight increase as well. But we don't have complete data yet for 2024, but we're still measuring it. But it's looking like there has been a slight decrease since 2023 in the impacts of opioid in the state. At the time of the opioid epidemic, the COVID-19 epidemic and its impact on opioid use in the state, it also created some additional hurdles for healthcare and support systems already facing additional stress that year. Illicitly manufactured fentanyl emerged significantly in the Oregon drug supply in 2020, which also increased the impacts and fatalities of opioids in the state. And this emergence in Oregon was actually much later than its emergence in some states in the southeast of the country. While all drug overdoses were high in 2023 across Oregon, non-fatal drug overdoses decreased slightly in 2024, and opioid overdoses also decreased in 2024. And the fentanyl issue has actually been a pretty significant factor, complicating the crisis, not just in Oregon, but multiple states. And this potent opioid poses substantial risk and contributes heavily to overdose concerns in Oregon. In response to these upticks, January 2024 saw a coordinated effort by Governor Tina Kotek, Multnomah County Chair Vega Peterson, and Portland Mayor Ted Wheeler, as they declared a 90-day emergency to address the surge in illicit fentanyl use and to basically get more coordination between local providers and agencies to address rising opioid and fentanyl use during that time. So, additional context. I think it's really important to put Oregon's opioid impacts within a stronger context for everybody. For instance, Oregon is the 23rd lowest in the U.S. for substance use overdose rates, reflecting the effectiveness of its strategies and what that looks like compared to other states in the U.S. In comparison, states like West Virginia and Tennessee face some of the highest impacts from opioid misuse, specifically when you look at the measurement of opioid fatalities in those states. The landscape to prevent and address opioid use is a landscape that is actually rapidly changing, with efforts to implement prevention strategies and lesson plans in schools, increased availability of naloxone, and increased harm reduction efforts across the state, including the statewide rapid response system that allows folks to partner with local resource providers who do outreach to communities and to try and address opioid impacts quickly and with additional supports. In Oregon, the opioid crisis presents unique challenges across both urban and rural regions, with certain counties experiencing significant health impacts due to opioid use, as you can see in the boxes that I provided. Clackamas, Jackson, Jefferson, Lane, Multnomah, Tillamook, and Washington counties have all faced some higher challenges because of opioid misuse in their areas. Multnomah County in particular saw, I think, a 500% increase in synthetic opioid-related fatalities from 2018 to 2022. And this increase primarily affected some pretty vulnerable residents and communities, including a 78% rise in fentanyl overdoses amongst individuals experiencing homelessness in the area. Even though urban areas like Portland and Salem benefit too from increased funding and targeted resources, they also continue to wrestle with high rates of opioid overdoses and the resultant strain on emergency services in those areas. On the other hand, rural counties such as Josephine and Baker are also witnessing some upward ticks and increases in overdose deaths, and I think emergency department visits, especially because of opioid use. And in some of the rural areas, this can be aggravated because of a lack of resource providers and resources to address the issue. Either a lack of awareness, a lack of promotion that those resources are there, or they just don't exist yet in those areas. I also want to note that there are some disparities in socioeconomic factors, particularly poverty and, as I mentioned earlier, homelessness, that can complicate the efforts to address the opioid epidemic. And when we look at the groups most impacted within Oregon, young men aged 25 to 39 are among the groups most affected by opioid-related fatalities in the state. So Oregon's detailed demographic trends. So this data highlights significant disparities tied to gender, age, race, and ethnicity. Males are particularly impacted with higher rates of opioid fatalities and usage compared to females. This actually aligns with national patterns where young men typically exhibit the highest rates of opioid-related deaths and are more likely than women to visit hospitals and emergency rooms because of an overdose due to opioid use. For younger Oregonians aged 10 to 24, while the fatal overdose rates are comparatively lower, there has been a notable increase with the rate rising from, I believe, 9.7 per 100,000 residents in 2022 to about 12 in 2023. This surge kind of points to a need for some targeted resources for this age group. And data reveals, as you can see in box 2, that while white residents hold the highest absolute counts of overdose deaths in the state, the rate of fatal overdoses is more pronounced amongst American Indian and Alaska Native and African American communities within Oregon. And that's when we look at its impacts with absolute counts versus rates. So this is the next few charts just sort of look at what the different impacts are amongst 10 to 24-year-olds. As I noted, they are the third highest in the state. So for these are the impacts for hospital visit rates for youth, and as you can see, and as we noted earlier, there's that uptick during 2021 and the COVID-19 year, and also during 2023 there was another minor surge. So with the opioid emergency department visit rates amongst this population, there's just been a steady trend upward since 2020, peaking in 2023. And for fatality rates, sort of similar, like a steady trend upwards with a bit of a decline in 2022 and then another upward trend in 2023. And a lot of the new data that we're getting that's reflective of 2024, it does look like in these areas there's been a slight downward tick. So here's some perspectives from Oregon students taken from a survey in the state. So most Oregon students, when surveyed, reported not using opioid drugs. Only 1% or fewer reported using prescription opioids without a doctor's order or differently than a doctor had initially prescribed. Most students in the state seem to understand the dangers associated with opioid use. And most students reported being disinterested generally in using opioids in any kind of way that might cause them harm. And the majority of the students in this survey reported recognizing and understanding the risk of harm associated from taking opioids, prescription drugs, in a way in which they are not prescribed to them. So at this moment, I know that that is a lot to cover, both about the opioid impact across the U.S. and the opioid impact in Oregon. But if you have any thoughts on this data, anything that surprises you, could you please just drop it in the chat? And also please answer the poll question that we have as well. I think we can share the results of the poll. So it looks like 84% are not surprised, 9% were surprised, 6% were very surprised. So I think for the most part, maybe it seems like our audience and folks here are aware of the impact of opioids amongst the youth and amongst folks in their state. So I think at this point, I am going to transition to Colleen, who is going to cover Oregon's response to the crisis.
Thank you, Derek. I'm Colleen Carter, a research associate with WestEd. And so now that you've learned more about the opioid epidemic and its impact on young people in Oregon, I'm gonna talk about the legislative response to the opioid crisis. So there are two key education agency responses in Oregon that you need to know about. That's Oregon Senate Bill 238 and House Bill 5204. There are other responses across different agencies, but today we're focusing on the responses specific to education. So Senate Bill 238 updated the Division 22 standards to require that school drug and alcohol prevention programs must reflect dangers posed by opioids. This also includes synthetic opioids and counterfeit drugs, which Jennifer defined for you earlier. In addition, districts and public charter schools must implement ODE synthetic opioid prevention lessons in grades 6 through 8 and once in high school for 24-25 school year. Next, we had the House Bill 5204 in 2024. That House bill appropriated funds to ODE to create new curriculum supplements on the dangers of synthetic opioids, and this is currently in development. So now we're going to look at the requirements for schools as outlined in Division 22. I'm going to give you an overview, but Alana Russell will be speaking more on this in the Q&A session with Derek. So for the 24-25 school year, Division 22 requires districts to develop a comprehensive substance use prevention and intervention plan that's specific to the unique needs inclusive to all students within each district. The Division 22 requirements will cover 5 areas. K through 12 instruction, which also includes annual instruction for grades 9 through 12, ensuring that it aligns with the 2023 health standards. Policies, rules, and procedures related to substance use and intervention. Communication, ensuring communication to students, parents, and district staff. Staff training and development. And lastly, school board approval, which requires an annual review. So now I'm going to go ahead and pass this over to our guest speaker, Alana Russell with ODE, and Derek Lowry for our Q&A session.
Thank you, Colleen, and thank you, Alana, for joining us to do this Q&A. So our first question for this Q&A session is, can you provide some additional information about how public school districts can meet the compliance requirements?
Yes. So I always advise districts to start with a needs assessment and an assessment of what you have in place. A lot of school districts have the puzzle pieces that they need. It's a long list and it can be daunting sometimes, but when you sit down and you look at all of the things that are happening in a building and in a district, a lot of times the requirements are there. They're just not pulled together yet into a plan, or sometimes they live in other plans, like their comprehensive suicide prevention plans that are a part of another Division 22 requirement. So taking the time to look at what's happening across the district, across the school buildings, a lot of times you have more than you think you do. So starting with that. And then a focus on those instructional materials is often a good place to start. There's a lot of robust guidance and resources from ODE within that area already. So there's the 2023 health standards that schools are required to align to as part of that Division 22 requirement, and that's a great guide. Your health curriculums that are adopted to align with those standards are a really important place to start when we're talking about prevention education. So focusing on those. And then making sure that there is an emphasis on health education in all grades, including that K through 5 age group is an important place to focus when we're talking about kind of starting off our compliance journeys. I also really encourage schools to think about your upstream things, again, that you're already doing, your transformative social emotional learning. How are you creating safe and inclusive spaces in your classroom? That's part of your prevention framework. That is part of this Division 22 piece. And then look at opportunities for intervention and referral. So these are systems that are probably in place in your schools, but focusing on how can we leverage those moments, those interactions with students to not just be in compliance with Division 22, but have those compliance requirements be responsive to the needs of our students. So a lot of touch points are when we identify students with substances at school. That's a wonderful opportunity to engage that intervention and referral piece versus maybe some disciplinary action. And so thinking about touch points with students that align with Division 22 is another important place to look. And then, of course, new resources. We'll get into these in future webinars, and I know we'll probably talk about them a lot in this Q&A session, but We are releasing a lot of resources to help districts meet these requirements, just very straightforward, right? The K-12 instructional requirement, we are releasing supplemental lessons, or we have released supplemental lessons to help support that. There's the annual opioid prevention lessons that are directly a part of the Division 22 requirement on the ODE webpage to help engage with that. These webinars can be used to help meet requirements. And we'll talk about some additional resources that are coming out as well that just directly translate to your Division 22 requirement.
Thank you, Alana, for that answer. You also touched on a couple of things we are going to discuss in the very next webinar, like how to recognize and then assist students who may be dealing with opioids if you're an educator, and also alternative discipline, which is a whole section in our next learning session webinar. So I definitely encourage everyone to register for that if they haven't. And some of the resources that Alana discussed, specifically the Division 22 legislation, and other things, my colleague Erica is dropping into the chat for everybody to access, and we will be following up with an email afterwards with lots of additional resources and links from ODE that we can share. The next question, Alana, is what are the primary challenges that schools face in becoming compliant with the substance use prevention and intervention Division 22 rule? And I think you touched on it somewhat in your first answer.
Yeah, I think one of the primary challenges is just an awareness of what it really means to be in compliance and what are all the different components of Division 22. There's a lot of Division 22 rules, and within them, there's a lot of requirements, right? And so sometimes it's just an awareness of what it really means to have a comprehensive substance use prevention intervention plan. It's not just a policy. It's not just health curriculum, even though those are both really essential parts of it. But it does go beyond that. And so one challenge is just an awareness and an understanding of what we mean when we say communication with staff, families, and students. What does that actually mean? What do we mean when we say annual review? Kind of just really clarifying with folks what those pieces actually entail to meet the requirements is a big challenge. But you know, it's kind of ever evolving, and it's an ongoing conversation that we have with districts. It's not unheard of for districts to think that they're in compliance, and then they realize that there's an area that they are not as strong as they'd like to be, and they self-report non-compliance so that they can grow in that area. So that definitely can happen and is an opportunity for districts to really build out their response plans. Another piece that I hear from districts that's just a logistical thing is that 9 through 12 annual instruction. I know it's tough for districts because students usually have health once or twice in high school and not every year. And so districts get really creative with how they address that one. Sometimes they use advisory classes or other non-health class spaces to meet that requirement as well.
Thank you, Alana. Can you talk a little bit about the support that's available for schools?
One is me. I am your technical assistance point of contact. I always want districts to feel like they can reach out to me. We can set up a technical assistance meeting. We can correspond over email. If you've got specific questions, you need specific resources. That is what I'm here for, is to help you make sense of this rule and to align what you're doing with the requirements that we have at the state. So please do always feel free to reach out to me for technical assistance. We also have the resources that are listed on our ODE webpage and the upcoming ones that we'll be diving into in future webinars. But we've got the annually required opioid prevention lessons, which are just a direct part of that Division 22 requirement that are linked on the webpage. We have we'll have K-12 lessons, supplemental lessons that can be incorporated into existing substance use prevention units to help with the instructional piece. We have a communication toolkit coming out that'll help with the communication piece. We have this webinar that you can use the slides, you can use recordings to help with staff training. So we can help address that piece. We have comprehensive plan resources. That's a very direct way. We will be releasing some tools that you can use to build a plan. So that will certainly help you all. I know it's not out yet, but it is coming this summer. So stay tuned for that. And then we'll also offer ongoing professional learning opportunities to support folks. Some other things that exist out there, there's the ODE and Oregon Health Authority fentanyl toolkit. That's been around for a couple of years now, and it's got really great resources that can be incorporated into your plans. accessing data sources that exist. So schools take the student health survey and the SEED survey. There's also oftentimes like community needs assessments that go on with local public health departments or local CCOs, coordinated care organizations. You can use data from your area as part of your annual review requirement. So pulling in that information and pulling in the community partners that generate that data and offer other support. So maybe that's your local public health authority or a local nonprofit. All those resources can be tapped to help build out these plans.
Thank you. And could you, I know you may have covered it, but is there any other material that maybe school districts can use to meet the annual requirement for training on substance misuse and opioid misuse strategies in schools? Would any of that material be different from what you just highlighted?
Yeah, so I know I said this webinar is one, and then I would certainly start with your comprehensive plan. The point of that training is to familiarize staff with what's in the plan. So start there. You can build, if you're taking the time to build a plan, build a slide deck along with it, and then that's a big component of your training right there. And then engage content experts. And a lot of districts have content experts somewhere within their school communities. So maybe you are really lucky and you have a substance use prevention coordinator in your school. That would be someone to tap to help support staff trainings if they're able to. But you can also think about things like drug and alcohol counselors. You can think about school resource officers, maybe school nurses, school psychologists, school counselors that may have an expertise, right? It's going to look different in every district and what content experts they have access to. And then again, engaging community partners. A lot of times there are community partners that have content experts that are willing to come out and do staff trainings. So lots of resources. I know you have to get a little creative with that one. It can be a tougher one to meet, but those are some ideas.
Thank you. And for your last point, that's going to be our third learning webinar where we discuss different ways that schools can coordinate with local service providers and local organizations doing this work, and how to engage them on working collaboratively with school districts. We will also actually have two guest speakers who are doing that work now on that webinar. Thank you for that answer, Alana. I think at this point, can you talk a little bit about the role that parents and guardians play in these prevention efforts and how they are being engaged by schools and ODE?
Yeah. So, I don't know that I need to tell anyone on this webinar how essential that component is. I think we all recognize the critical role that families, caregivers, parents play in youth substance use prevention and intervention. So it is simply put a requirement of Division 22 to be engaging parents and families. But what does that actually look like? There's a lot of really wonderful ways that I've heard districts and communities do this. One is communicating about the curriculum. Bring parents and invite them to review the curriculum, the instructional materials that you're going to be delivering in the classroom, have open conversations about what that looks like. You can also send home follow-up information, right? So if you're talking to a group of kindergartners about medicine safety, are there resources that you could send home to families so that they can continue those conversations at home or reflect on their own safety practices with medications in the home setting? Bringing them into what's happening in the classroom space and engaging them in those conversations is really important. There's also a lot of communication resources. We're coming out with some that are specifically for parents, for schools to share with parents, but I know that there are communities across the state that already have some like social media materials or other campaign resources that you can use to send home, newsletters that could be sent home to parents to share information, again, about what's going on in school, but also more broadly about substance use prevention in youth. So messaging campaigns is another big one. Parent information nights, I've heard great things about people that host information nights for parents, whether that is the local public health authority, maybe they come in and they coordinate with the school district, or maybe it's a local law enforcement agency that partners with the school district. And you can host parent nights so that parents can come in, they can get some information. Maybe there's a naloxone training tied to it or something like that, a distribution event, or engaging at other community health events, kind of in a similar model. If the school is having a health fair, bringing in that information to engage parents there is another great way to do it. And then intervention is another really important moment to be thinking about how we're connecting with parents, caregivers, and families. So if we are going to be referring a student for services or providing alternative to suspension intervention for students that were identified as being at risk for substance use disorder or using substances on campus, there are programs out there that have an active engagement of the parent as part of the program. And so the delivery of that program involves engaging and communicating with the parents. And so that's another really important time to make sure that at a minimum you're communicating with the parent what's going on, but certainly you can go beyond that and be bringing them into the intervention efforts themselves.
Thank you. That sounds like any kind of program. The next question, can you talk about any other ODE programs that might be doing substance use prevention and intervention efforts in the state?
Yeah, a
Thank
really
you.
important one for folks to be aware of is the recovery schools team and the recovery schools across the state. So recovery schools are a specialized public school setting for youth recovering from substance use disorder and co-occurring mental health challenges. It's a wonderful environment where students are supported. They are provided additional supports, but still fully access their high school education and get a high school diploma. And we see really promising rates of graduation and long-term recovery for students that are able to access one of those schools. Right now, I believe that there are three that are running across the state, but there are applications open for others to be stood up in other parts of the state. So that's one really important area. I also want to kind of just bring us back to the upstream pieces and the overlap that exists with lots of the other my other teams at ODE and the other work that's being done at ODE. So when we talk about transformative social emotional learning and all of the work that's done there, all of those pieces are essential for substance use prevention, even though it happens oftentimes long before they get to a substance use prevention lesson or intervention. That's where we're learning stress management techniques. That's where we're learning a lot of our decision making and our value building, and all of those things happen within those lessons and in that context. Our Safe and Inclusive Schools team is doing a lot of work, and I know we have someone from that team that will join us to talk about some of those other upstream pieces to create safe and inclusive school environments where a lot of our substance use prevention work lives. Our suicide prevention work has a lot of overlap. Again, things like restorative justice, things like bullying prevention, meeting needs of students with disabilities, those all factor into substance use prevention.
Thank you. I know that in a future webinar, we're going to be actually talking to community-based providers who do this work and how they coordinate with schools. But could you maybe talk a little bit about the opportunities that exist for schools to work with their community partners around like addressing the requirements that they need to address and then working closely with students and families? Because I believe like in any state, there's going to be different challenges facing schools trying to work with providers, depending on like who is available and who has experience working with their target population. So maybe you could just talk about that a bit as well.
Yep.
Thank
You're
you.
absolutely right that it's not a one size fits all. Every
Mhm.
community is going to have different relationships. They're going to have different resources available. There's going to be different levels of trust for different agencies, right? Based on your community and what agencies maybe they're used to working with or they're familiar with. So being really responsive to the needs of the families within a district community, I think is really important. And identifying who might their trusted messengers be for things like this is one place that I start when I'm having these conversations. And then schools, I really encourage them to just start reaching out. Oftentimes, partners want to engage with you. So sometimes it can be intimidating to just reach out and ask what services are being offered, but I don't think you can go wrong doing that most of the time. So reach out to your community partners, find out what services they offer, and then start looking at where you can plug those services in. Is there a gap somewhere as you do your needs assessment for your Division 22 compliance and your planning? What are the gaps? Is it staff training? Reach out to community partners and communicate that need with them. See if there's anyone that can provide staff training. Maybe it's communication with families. Reach out again, see if you can find a trusted messenger to come do a parent night. See if they would be willing to engage that way. People get really creative. And a lot of times too, agencies have touch points in fields outside of substance use prevention, right? So maybe you've not engaged with your local public health department around substance use prevention and intervention, but you have a really great early learning touch point, and they come out and they do vision and hearing screenings at your kindergarten roundup. Could you reach out to your contact there and they can connect you with someone else within their agency that is doing substance use prevention work and that kind of thing?
Thank you, Alana. And I think that the Oregon Health Authority, OHA, released a pretty up-to-date service inventory list of different organizations doing this work that they've kept up to date on across the state. That could also be a useful tool. I think we'll be sharing it in the next webinar. Thank you for answering that question. The next question is, are there any early indicators of successful interventions that suggest a positive trend in reducing opioid use among students?
Yeah. I think that you touched on them, right? With the exception, I believe, of cannabis, we are seeing a reduction in substance use rates across the state. And so I do find that particular data point really encouraging. Um, a lot of the interventions that we're doing, we've just started. And so we know that with any sort of behavior modification and health outcomes, it takes a little while for us to see those results. And so we certainly have data points that we're going to be looking at and monitoring in the coming years once we have kind of implemented some of these more school-based interventions. But I am encouraged by data up to this point that shows a positive trend.
Thank you. So we have about 14 minutes left. I want to thank you for answering all of my questions, Alana. And let's open the floor to questions from the audience. So I encourage you all to drop any questions you have for Alana or us at WestEd into the Q&A tool, and we will do our best to answer them. And as you do that, I think we already have a few questions. So the first one is, have the opioid deaths been disaggregated by race? And they have been disaggregated by race in Oregon. And it helps it helps the different agencies that do this work and collect this data to kind of zero in on all the racial and ethnic groups that might be impacted. And I believe that this is a pretty recent statistic, but I think Black communities were really impacted a few years ago. This isn't a recent statistic in Oregon. It was a pretty large uptick. So being able to disaggregate data by race allows us to kind of zero in on different impacts amongst different groups. The second question was, how old are the students that answered those questions? The survey, I think it was a pretty large range of middle school and high school students, but I would have to go back and look at it, and I can share the survey in our follow-up material to everyone. Another question from the audience is, and this is a question for you, Alana, is how are school districts being held accountable to meet these requirements? Can you talk a little bit about accountability?
Yeah. So as part of Division 22, school districts report annual assurances, meaning that at one long form, once a year, they submit to us at ODE if they are in or out of compliance with those requirements. And then if they report out of compliance, we follow up with them to engage the district in a plan of action to get them into compliance.
Thank you. And this is a question, and I think I have a colleague who's going to respond to it. Do any of the presenters have lived experience with drug use?
So Derek, do you want me to respond to that?
Yeah, Jennifer, if you don't mind sharing.
Sure. Yeah. So while I personally don't have experience with a substance use disorder myself, while yes, I'm a doctor, I'm a practitioner in this field, so I have the passion to, work on this professionally. Personally, and as I mentioned when I was speaking, we've all lost or have maybe know someone who's been impacted or even died. I've lost both a mother and a sister to this epidemic. So not only professionally as a practitioner do I work on this, I also have that that personal side to this and why I do this work. I watched both of them navigate in the early 2000s, the epidemic, as we weren't calling it an epidemic then, but navigating their substance use disorders related to prescription opioids and becoming addicted that way, and really seeing them try to navigate their disorder, plus navigate resources within the system, the lack thereof, and really trying to help them through their, working through their substance use disorder. My sister was a medical doctor. She worked as an internist and an oncologist. And so she was a part of that, kind of marketing to doctors saying this is safe. So not only was she prescribing that to her patients, she was also then using it herself, and ended up passing away in 2004 of an overdose. And then the same with my mother, who dealt with chronic pain her whole life. And then when Oxycontin came out, this miracle, so to speak, miracle pain drug came out, she then also became addicted, and we lost her in 2009. So what I always say when I talk to folks like you all who are working in this field, you're working day to day with youth families, and in your community, always kind of think, Derek and I have talked about statistics today. We've talked about a lot of statistics, but always think about what's behind those statistics. Behind those statistics is a person, a mother, a father, a cousin, a brother, a sister, a friend, right? A neighbor. There's always somebody behind that statistic, and there's always a story that goes along with that statistic. So keep that in mind as we work through this. We talk a lot about the numbers, but we're really talking about human lives. And that's what we're here to do, is really just save lives. So any part that you can do to collaborate, to better communicate, develop resources, engage in resources, to do your part and your role, is how we're going to really combat this overdose epidemic.
Thank you for sharing, Jennifer, and thank you for that question from the audience. Um, another question, Alana, I think it's for you, and I know we kind of touched on it, so I don't know if you want to add to this question. But somebody notes that it would be really great if those who do this work outside of the schools could actually, like they want to work with the schools, but they're basically expressing how difficult it is sometimes. Is there like a specific contact that you think within school districts, or a specific coordinator with an ODE that they can maybe work through, or do you have any other suggestions for strategies that they can employ?
Yeah, I know that this can be really tough. And I know that there's a lot of really wonderful community partners out there that are wanting to support and engage with school districts. Um, One, I will say you are always welcome to use me as a liaison. If I can help facilitate communication with a district, I'm happy to help support that if it's a district that I have a contact with that I know is open to that. So please do feel free, like you can reach out to me. One place to start, it's going to be different in every single district, even within one county or region, right? It's going to be different. So things that you can do are reach out to your regional education service district and call and ask if they have anyone that coordinates substance use prevention or supports substance use prevention that you could be connected with. And similarly, you can reach out to the district office and just ask them, is there anyone that's doing this in your district that I could be connected with? Because it's not always going to be one person. That would certainly make it easy. But unfortunately, that's just not the way it really works in our landscape here. As far as practices, when you do go to reach out to them, some things to just keep in mind. There's the simple stuff like don't reach out to them in September or August because they're probably really overwhelmed and are not going to be able to get back to you. So try to find a time once that like start of school rush has settled down to reach out and engage them. Similarly, remember winter breaks, spring breaks, things like that. I know it's the easy, like low hanging fruit, but sometimes those reminders are helpful. When you reach out to districts, I suggest starting with initiatives that are already in place for them or requirements that they already have before trying to add new things. So once you can talk to somebody, see if you can identify what are their most pressing needs, right? Maybe it's not opioid prevention. Maybe in their mind right now, it's vaping prevention, and that's what's taking up most of their time. See if you can start there, helping address one of their needs, understanding that all of this work is connected, and it's a way to build trust, and to start kind of building out systems and trust where you can integrate other interventions potentially later on. And then also, if there's a way that you can support one of their requirements, districts tend to like that, right? So if you can say, hey, I know that you guys have to be doing this instruction, and here is a way that we can help support that. That's another way to address that. Having a shared language with districts is really helpful, and having a shared kind of goal there as far as helping them maintain their compliance can be really helpful. I always advise, and this is across the board, right? If I talk to districts, I say the same thing. Patience and grace goes a long way, right? Everyone is on the same team and everyone has a goal of keeping our students safe and healthy. That is what we all want. And so sometimes folks are overwhelmed on one side of this or the other. And it doesn't mean that the door is closed and it doesn't mean that they don't want to work together, but it might mean that we need to revisit the conversation or come up with a new approach. So all of those things are just worth keeping in mind when you're engaging districts, because I know that ultimately those partnerships can be really beneficial for folks. They just take a little while to build.
Thank you, Alana.
Yeah,
And so
school counselors, I do see someone in the chat. School counselors are often a really good touch point for this. School nurses are also a really good touch point for this. And then certainly if they have a substance use coordinator, that's a great way to go.
thank you. So I noticed that one of our questions was about the recovery schools and where they're located. I know there are too many, probably, Alana, for you to go through and tell us where they're located. So we have a link to a web page, I think on ODE, where they provide where all of the recovery schools are within school districts in the state. So we're going to provide that link in the chat for anybody who would like to access that. But do you have anything else to add about recovery schools, Alana?
Yeah, I mean, I can tell you where they are. There's two in the Portland area and one in Salem.
Okay.
There's
Oh,
just
I
the
thought there
two
were
for
more
right
than
now.
that.
Someday, hopefully there will be more, but right now, and I do think someone linked in response to that, the three different
Okay.
sites for those recovery schools as well.
Thank you. We only have a few more minutes left. I think maybe one more question and then we'll close out is, do you offer trainings for families and community members? And that's probably a question, yeah, for you, Alana.
I'm sorry, Derek, my audio cut out a little bit. Do you mind repeating it for me?
Yeah, the question was, does ODE, I think, does anybody in the state maybe offer trainings for families and community members that they can take around this issue?
Yeah, right now, as far as substance use prevention specifically and opioid overdose prevention specifically, not that I'm aware of that's coming from ODE. Our role currently is supporting districts in doing that outreach and training themselves more as like the local trusted messengers, right? That's kind of, it's part of their Division 22 requirement. Education service districts are also a place that can offer more regional localized training for parents.
Yeah.
Oftentimes in partnership with things like local public health authorities, right? But at our state level as ODE, at this time, we do not.
Okay. Thank you so much, Alana, for answering our questions and for also answering our audience questions. So I think we're going to close out at this point, and I just want to, before we end, I just want to point out that we have three other future virtual learning sessions coming up. Session 2 will be on May 14th. From 3:30 to 4:30. What can you do? School-based opioid overdose prevention discussion. It will also have a guest speaker from Oregon. Session 3, what's happening now in Oregon? The current landscape of prevention, treatment, and resources will be on May 21st. We will also have two guest speakers, one from OHA and one from Lane County, who will join us for a Q&A. And then our final session will be on May 28th from 3:30 to 4:30. What's new in Oregon? School lesson planning, public information campaigns, and learning opportunities. And we will have two guest speakers there as well, specifically to talk about the upcoming lesson plans. You can also use this barcode here to register for other sessions in the VLOs, and we're going to include a link in the chat, and we will follow up with a link too. And thank you, and please, if you don't mind, complete our follow-up survey to this learning session as well. Tell us what you found helpful.